Assalamu alaikum. If you can hear me all right, then please raise your hands. If you hear me all right. Thank you. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم قل هو الله أحد الله الصمد لم يلد ولم يولد ولم يكن له كفوا أحد. Say, He is Allah who is one. कह दीजिए वो अल्लाह है जो एक है. अल्लाहु समद. Allah is the eternal refuge. वो बेनियाज है, सब उसके मोहताज हैं. लम यलिद वलम यूलद. He neither begets nor is born. ना उसने किसी को जना और ना वो जना गया. वलम यकुन लहू कुफुवन अहद. Nor is there to him any equivalent. और नहीं है उस जैसा या उसका हमसर कोई एक भी. सुब्हानक अल्लाहुम्मा व बिहम्दिक अशहदु अल्ला इलाहा इल्ला अंता अस्तगफिरुका व अतूबु इलैक. बिस्मिल्लाहिर रहमानिर रहीम. So, today we are going to discuss the importance of ultrasound examination as a routine screening of the whole body where ultrasound can be applied. This idea came to my mind after practicing ultrasound since 1984-85. Whenever I came across patients who presented with some clinical conditions and they came for ultrasound. But besides their complaints and besides focusing our ultrasound examination to those areas where patient was having complaints, we were able to find some incidental findings, and some of those incidental findings, some of those clinical conditions which we were able to find were those conditions which were life-saving at times. For example, a patient is presenting with some pelvic pathology, with some pelvic pain, etc. And I just did the examination of the abdomen because my patient requested that it is good if I could see the rest of the abdomen for him or her. And to my surprise, I was able to diagnose malignancies in the kidney, in the gallbladder, etc. And patient was not having any complaint related to those organs. On top of the list were carcinoma of the kidney, gallbladder, ovaries, pancreas, and in a few cases, even urinary bladder, enlarged lymph nodes, metastatic lymph nodes, lymphomatous lymph nodes in the abdomen, etc. So it was there in my mind that when we have this fascinating modality without any side effects, and when you have enough experience of doing ultrasound and you start enjoying ultrasound, it is always very good to screen your patient, to have a screening ultrasound done for your patients, because in third world countries and countries with little facilities, health facilities available to the society, I think that ultrasound examination is a blessing. When I was in Japan in 1986, across the hospital we had a screening center attached to our teaching hospital where we used to go regularly, where most of the civil servants of Japan, they used to come for screening alone. They were not having any complaints. So in those screening visits, a medical officer would take a history. They will go through routine blood and urine tests. Smokers will go for a chest x-ray like that. And they then included a routine ultrasound for them. We used to perform around 30 examinations per person per day. And when, after a year, we gathered all those that examination results, we were able to find that for each 1,000 examinations, we were able to find two patients with a malignancy, 2 out of 1,000 examination. Early malignancy, whether it was in the gallbladder, in the liver, kidneys, and those patients, they knew nothing. They were all symptom free. So therefore, ultrasound examination now in Japan since 1986 is considered a screening tool. Over there, we were doing only abdominopelvic ultrasound, but later on, I thought that it is good to see all those ultrasoundable regions with a convex, a linear, and wherever indicated an intracavity probe like transrectal or transvaginal probe. So the selection of patient, we must remember that any patient of any age, infant, puberty, at puberty, young adult, middle aged, and elderly, all individuals, they must go for this routine whole body ultrasound examination as a screening examination. They are not having any complaints at all, and we will be focused only upon the examination of organs, determining their status, their normal appearance, if indicated, we will do some measurements, and if we find a certain pathology which requires further investigation, we will do that. This examination is, as I repeatedly saying, that this examination is for all so-called healthy individuals who are following their routine. They don't know anything about their status of health of different organs. And as we all know that a typical Pakistani culture and a third world country's culture is, because of the very expensive medical facilities, none of the third world country individual will go to a doctor unless he or she has got a complaint. So routine health screening has never ever started in third world countries. We all know, especially I ask my lady doctors who are coming here for training, that even those who are educated and they know the importance of screening, they themselves, they don't go. None of my senior trainees will go for a routine serum PSA level or CEA level, other tumor markers, especially the PSA level for senior doctors. None of the lady doctors will go for a pap smear at all, at all. So therefore, I believe that at least what we can offer our patients, which, as I mentioned, at times will prove to be life-saving and at times will prove to be helping us in advising our patients to look after certain benign conditions, benign in the sense that if, for example, we come across a patient